worst, bitch.
I already got one of those.
Alright.
Who? Oh, okay.
So, do you support like federally licensing like physicians and clinics and doctors so they can operate across state lines like they do in Switzerland in a national marketplace, the way airlines and pilots operate?
The insurance companies or the clinic?
All the providers, as well as the actual insurers. So that
I've actually not looked at that. So that sounds
that's the healthcare system that they've had in Switzerland since the 1960s. Since they got rid of the capital gains tax, or actually they never had a capital gains tax. So everybody has private health insurance, and there are no pre-existing conditions because every kid is covered by the third trimester. So everybody who's born is automatically covered. You have to insure before you're born. And then, of course, the provision of care is so much lower because there's so many providers operating in both public cantonal hospitals as well as in private hospitals. Right here, we have like a system where the states have created a kind of mafia-like cartel for themselves.
I know they've done that with insurance.
We've done the same thing with the providers. You have Ascension here, you have Aurora, you have Greater Medical Health. There's only 3 players.
I know that. I just didn't know if there's any analysis out there. I'm not saying there isn't that Illinois health systems would come into Wisconsin if you.
I think they would. I think Barnes Jewish Hospital in St. Louis would probably move into Janesville and Madison. It's only a 5-hour commute for their practitioners. I think a lot of them probably move into Central Illinois to be able to cover both locations. And I think you'd probably see Northwestern Memorial move out of Lake Forest in Lake County, which is currently the most northern care center, probably across the state line in the ocean or sea, where real estate is even cheaper for really good facilities.
Okay, well, if you have if there are any articles and stuff on that,
there are. I mean, I think the costs drop dramatically when you have more than just a triumvirate of providers of care as we have in Metro Milwaukee. And in Madison, it's pretty much the same thing.
But I can tell you, it doesn't mean it's not true, but I'm saying that it's not on the radar screen as far as the major national meetings on healthcare.
That's because nobody's talking about it.
Right.
And I think I talked with Paul Ryan for over 2 hours in 2012 and gave him contact both on the left and the right of the political spectrum in Switzerland, both the Social Democrats and the Swiss People's Party, both of whom agree that their healthcare system is fantastic. There is no debate about healthcare over there.
Right.
And he never contacted them. He asked me how he could get in contact with the former president Ruth Dreyfus. He said, try the Swiss embassy. He seemed puzzled, and then of course we've never seen any Swiss politicians ever on the floor of the House talking about their healthcare system. So, yeah, I think that'd be a good model, but right now nobody in the United States seems to be promoting the idea of federally licensing all the clinics, the hospital groups, as well as the insurance companies.
Yeah, the insurance thing has not worked where states have tried to do it themselves on spying across state lines.
But it needs federal legislation. Right now we're not seeing any federal legislation to create a national marketplace where the best providers of care are able to gain market share for themselves nationally.
Right, no, here's the general problem is that these kind of, that always sounds good, the market thing, but whether a market would actually work that way, you'd have to
It is when everyone has to buy insurance. I mean, when you have everyone buying insurance, markets tend to come into existence.
I mean, the issue with the healthcare market is just a complete lack of, most of it's not shoppable. Only 7% of medical care is truly shoppable.
That's because they spend a lot of money lobbying at the local government level.
No, it's not shoppable because it's not legitimately like buying a DVD player. In other words, you don't have a consumer situation where the consumer can easily pick and choose. And
that's because there's no menu for provision of care. Nobody knows what the prices are. Well, that's what we need. We need a provision of care. We need a patient's menu. We need a federal licensing of clinics, doctors, and hospitals.
But you can do one of those without the other.
Why not do it all? That's the Swiss model.
I know, but I just don't. I'm not saying I disagree. I'm just saying I'm not ready to jump in and say that the Swiss model is totally applicable to the United States. Not against it. I'm just saying that I have to see more.
The government-provided single-payer system in Germany is so much worse in its outcomes that many Germans buy supplementary Swiss insurance so they get care in Switzerland. Same thing with the French.
Oh, that's interesting.
Yeah, I mean, it'd be a very good model for the United States. But right now, there's no one, either in the Democratic Party or the Republican Party, advocating that model.
But I'm just not one to jump on one silver bullet right away. So I'm interested in this. So
I think having
there's a professor at Marquette, Sujima, who studies comparative healthcare here in the United States. So someone.
Yeah, the only country with a cancer survival rate is comparable with ours is Swiss.
Right. But It's hard to compare country to country. I don't even know.
Well, a lot of people in the Democratic Party want to copy the Belgian model, which is single-payer government provided, and their cancer survival rate, their overall life expectancy is much lower than it is in the countries that have private health insurance.
But you have to determine scientifically what the variable is, what that really causes it. So it's hard just to make those kind of broad brush comparisons.
I would say for male life expectancy, there's no country on earth that compares to Switzerland, and it's amazing because
I know, but you got to look at all the variables and factors. You can't just say that and say that's the cause. That the structure of the health system is necessarily the cause. It might be.
It helps. It certainly helps.
Well, it helps, but you don't know what percent it is, right?
I know that their cancer survival rate is higher than any of the surrounding Western European countries that have nationalized their healthcare system into a single-payer system.
As I say, you just have to. That doesn't prove that's the main cause. It doesn't
prove it, but it seems like a very good model. And it seems like it would work in the United States.
I mean, the structure of the health systems that literally how would create these giant nonprofit entities. I don't know if they behave the same way. I'm not saying they wouldn't. I'm just saying that I'd have to see a lot more to know that this is definitely the way to go.
We should contact guys, Tony Bruner, the Swiss People's Party, and Ruth Dreyfus and the Social Democratic Party in Switzerland. I'm sure they'll provide you with all the evidence and information you need on how their healthcare system
we do a whole lot of kind of policy wonking among people who believe in healthcare as a right, and then don't do the. I mean, our main role is to develop the market here for guaranteeing healthcare as a fundamental right. In other words, the market is public opinion. To organize around it. It's a long way before we're actually implementing a new national healthcare system in the United States. We're not doing it this year or next year. So,
maybe the idea is not to implement a national healthcare system, but to break down the barriers to the free movement of provision of care that the states have erected for themselves, because they get huge amounts of money from the providers themselves to keep costs extremely high. Then they give the kickback to the politicians in all the state capitals.
I'm not convinced that simply a market reform, even if it's more robust like you're talking about, is enough.
It seems to work for the airline industry this far. I think whenever you federally license and get a large pool and you have free movement, you're going to get better outcomes, more choice.
I mean, that's interesting. But
right now, nobody who has an Obamacare policy in any of the Milwaukee zip codes can get treatment at MD Anderson in Houston, Texas, at the University of Texas Cancer Treatment Center. The only people who can are people who are on Medicare or who are employed by a large corporation or who are public employees. So we've created, Obamacare's created two tiers of society.
We're writing about that, about someone who has, cancer, for example, and where they can go. Yeah, there is
that's the problem with Obamacare. It's extremely restrictive as to where you can get
primary care. But here's the thing, none of this happens without social movement. So these fundamental things of social movements and healthcare is right, because the political power in this country.
But Obamacare prevented people within the zip codes of Metro Milwaukee from being able to go to high-quality cancer treatment centers that have better results, better outcomes than any of the ones in Metro Milwaukee.
You know, why you think it hit?
Why did it do that?
Did it do that because they were making a policy mistake or because of political power?
Well, they're interwoven. Political power, right. That's why when the Democrats had the ability to say, okay, we're going to federally license all the hospitals and all the doctors.
Progressives didn't have the political power to make them create a better system.
So you're saying there are no progressives within the Democratic Party?
There's some, but there weren't enough.
So they're basically just corporate force.
It's not a black or white thing.
No, they appear that way.
Right, but
if they forced people to buy an insurance product,
when you say
the Democratic Party who passed Obamacare.
Yeah, but they're not monolithic, right? Senator Lieberman was a totally different player than Senator Kennedy.
They're different people. There's different personalities.
Not just personalities, where they are and to what extent they are strongly progressive or not. So our role as an outside, trying to create an outside movement is to create the pressure on the system that would enable fundamental reform, which including your Congress. That's our main business. That's that. So we know a lot about policy, but I'm not going to, direct visualization, spend most of my time studying comparative healthcare and doing my own research.
Well, I think it's important to know because then you have the data set.
A lot of things that are important.
Yeah, but when you have a data set that's based on objective outcomes as well as costs, it tells you what kind of activism to engage in. Is that when you know that there's a healthcare model that provides affordable insurance with great outcomes, that's probably the model that you should be pursuing as an activist.
It's not my understanding, for example, that comparative healthcare experts, if you go through them, and read a fair amount, so we do have to know a lot of policy to try to create a social movement, or have some sort of consensus that the Swiss model is the best model and we should all move to the Swiss
Because
model.
I don't think they like the Swiss model because it involves the elimination of the capital gains tax and a flat tax for people who start businesses. I don't think they want anything Swiss. I think they want to ignore all the sort of policies that they perceive to be right-wing from a right-wing country. I think they just kind of written it off and put it into a black hole. They don't even want to even have people even thinking about what's going on there and why do people have higher purchasing power parity in that tiny little alpine country than they do in a country like the United States. It has much more opportunity, much more resources.
I mean,
sort of like how educators don't want to, study the Singaporean or South Korean or Estonian or Finnish education models. They don't like the idea of 75 kids in a classroom.
I can see you're a true believer and you're very certain and you know a lot, which is great.
No, I'm just saying, I just look at the evidence and I say the evidence is pretty overwhelming.
You haven't given me evidence that would make me think that there's a slam dunk case that the Swiss model is the way to solve America's
Men live longer there. They're paying less than half of what they do.
In a lot of countries.
But their cancer survival rate isn't as good as it is in Switzerland, or like it is in the United States.
You're listing these facts as demonstrated to be related to the structure of their healthcare system, and you're also
it would appear to correlate very strongly.
And that it's entirely transferable. To a very
I think what you're advocating is sort of a national health service model that the UK
No,
has.
not necessarily. No, well, we're not taking a position right now on exactly what the structure is going to be.
So what structure would you like to see?
Well, I mean, if you look at Healthy Wisconsin, we've worked on some different models. We saw the Affordable Care Act as a step forward, as despite its imperfection.
So limiting people's access to high quality treatment through locking them into a policy.
When I say it's a step forward, it means I like every aspect of it. It was a
In what way was it a step forward?
Oh my goodness, it in a very progressive way as far as the taxation level. It invested a huge amount of money.
No, it overcharged people based upon their tax returns so they could subsidize other people getting insurance, the same awful insurance that they're forcing people at high income levels to buy who are self-employed. You're only offered a few options.
The biggest increase was Medicaid, right? And it dramatically expanded Medicaid. It led to the lowest level of uninsured.
But what's the provision of care? Where can you get treatment?
That's not a step forward to have the lowest level of people uninsured in the history of the country.
At what cost?
So
at what overall cost?
Did you prefer the previous system?
I would prefer a system where you have...
No. I asked a question, because all I'm saying is a step forward. You prefer the previous system to the Affordable Care Act.
I had more choice for treatment care as it was. That's why they voted the way they did.
We totally disagree. If you're not willing to admit the ACA was a step forward.
You can't get a policy living in Milwaukee as a self-employed person off of healthcare.gov that'll allow you to get treatment at Northwestern Memorial. Of course, I had one. I had an independent policy with Blue Cross Blue Shield Wisconsin that allowed me to go anywhere in the United States.
Why can't you buy that policy now?
They discontinued it because they're forcing it.
The Affordable Care Act forced them to discontinue it?
No, they chose to discontinue it because the Affordable Care Act was now available. So it forced me to lose options. It created a less competitive marketplace. It provided a less competitive marketplace.
Other people, but if you're not willing to concede the Affordable Care Act,
how can it be a step forward if it provides a less competitive marketplace where there's less places to get treatment and there are fewer options for people to get care? That's not a step forward.
I don't see why.
It's a step into the Mesozoic era.
I don't know how you can blame that on the Affordable Care Act, nor do I understand how you can say that that one element overweighs out all the other elements of it.
What are the positives? Other than just everyone has access to garbage insurance that helps subsidize the hospitals so they no longer have to write off emergency room care. That's all it did. It was a subsidy to the hospital for providers.
There's over 20 million more people have health coverage, and
at what level of treatment, at what level of care, at what price point do they start rationing that care off of?
Well,
there's two sides to the contract.
Saving about 8,000 lives a year.
Can you show me that?
I can send you a link. There's
8,000 lives a year are being saved by the Affordable Care Act. Could 8,000 lives have been saved per year, or maybe more, if healthcare was less expensive by more players being able to operate in state markets that are all being regulated at state capital levels?
If that was possible, if your assumptions
the federal government could have done that. The Democrats could have done that in 2009 when they had the majority in the House and the Senate. They chose not to make that happen. They chose not to give people more choices and not give people access to more options. They chose to control healthcare and regulate by zip code through a website what policies people could get access to. That's how Obamacare worked, and that's why society has rejected it.
I'm talking about society's rejected it. The majority is supported now, but the majority of Americans now support the Affordable Care Act.
do they? I'd like to see that.
Google it.
No, I'm not just going to Google it.
There are headlines all over.
I'm not just going to Google it. I'm just going to use a website created by InQtel to just find my information.
You've given me no citation on your information, so I'm giving you
well, look at the World Health Organization. Look at World Health Organization, Swiss male.
So the World Health Organization says that if the United States adopted the Swiss model, that would be better than the other.
I'm simply saying men there live longer. They have access to health insurance, private health insurance, that's less than half the cost of here, and they have no capital gains tax when they sell their stocks.
Well,
that sounds like a great option.
Well, you know, men live longer here than in Mexico, but you wouldn't say it's just.
Well, because there isn't much provision for healthcare in Mexico.
My email's on the website. You want to send me any additional information?
I'd be happy to send it all to you, as well as people on both the left and the right side of the political spectrum in Switzerland who advocate their healthcare system.
I think you're a little too certain of your position.
Well, when people on the far left and the far right of the Swiss political spectrum agree that their healthcare system is fine, doesn't need any adjustments, I would say it's probably a good thing. We're debating healthcare. They're not. They're talking about getting more business creation so they can get higher levels of per capita income, which at this point are already higher in the United States. That's a problem. And one of the reasons why they're a more competitive marketplace for investment and for business is because their healthcare system is more efficient, provides more options and more choice, which is sad in a country of only 8 million people. We should have more choice than they do.
I can hear you're convinced. I need more to be convinced.
Well, I'll send it all to you.
Okay.
Okay, take it easy.
There you go.
Subscribe, bitch.